Biswas, I'm here from Calcutta. At the outset, I must make it clear that I do not use the Orthoptek myself. It's used at the optometry department in our center, which is run by my wife. However, I was involved with the decision making of the purchase and signing the check.
Really?
Well, that was way back in 2021 when Gopal kept on bugging me and our center with the Orthoptek, the concept about Orthoptek. We met several times, and all the time I thought, kya bakwas bol raha hai? And how can this be? We were happy with patching, we were happy with synopto for exercises. Of course, one of the things that we observed is over the years, patching has definitely become unpopular. I'm sure all of you will agree that over the last 4 or 5 years, because of social changes, patching has become unpopular with students. They face a lot of flack from fellow students to the extent of getting beaten up and getting, they snatch away the patch and all, do lots of things. And students are scared to do patching and go to school. This has become a problem. So they have an inferiority complex. The students develop a kind of an inferiority complex when they do patching. So patching, I think, has developed a problem, and when we thought that this is perhaps an alternative, and I calculated the financial implications, and take itna cost hai, if we charge, he explained that if the charges are this much, then yes, okay, I understood that cost can be recovered in a short period. So with much reluctance, after working out the finances, we did plan to purchase one machine and have it in our center. And initially, just to try it out, I started giving our optometry department every case that came to me, XYZ, adult, God forsaken cases which previously we thought of no prognosis, and we shifted from synopto. We'll give them an opportunity with Orthoptek. One of the things that I noticed in the first few cases was that every patient gave a feedback that post-treatment, as less as just one session, and definitely by the third session, everybody reported that the letters on the Snellen's chart look better. That's for sure. Their reading ability might not have improved by number of lines after the third treatment, but they always said that the letters look better and sharper and easier to identify. That was universal even now. We selected initially patients of all age groups. Later on, we learned how to select cases. I'll come to that. We have treated more than 80 patients in as high as the age group of 67 from one of our doctor friends, a senior friend who has amblyopia, and he's been having amblyopia since childhood. And even he got hooked onto the treatment and kept on coming every week because he felt better. And he still continues it at his age. He's still continuing it because he is sure that it has made a difference in his vision.
Sure.
Okay. Majority of the cases that we treated are, of course, amblyopia, a less number of convergence insufficiencies, accommodative insufficiency, squint, etc. There has been a significant improvement of stereopsis in more than 50%. Numbers would have been better than 50%, as Dr. Reshma said, 90 to 95%. Perhaps our initial selection of cases were not very logical. And visual acuity in the young patient group, yes, 90 to 95%. It's only in the elderly age group that is little less, and that's why the overall improvement, I have put it as more than 60%. Across all the age groups put together. So I feel now that if the case selection is made cleverly, then the amount of time that is spent, the manpower, and the sessions of exercises is really worthwhile. In conclusion, this is my last slide. It's short and sweet for you, Gopal. The Orthoptek is undoubtedly a useful adjunct for a general ophthalmologist, no doubt about it. Financially viable, we recovered the cost in less than 6 months at our center. Ours is a tertiary care center in Calcutta. and it is any day better than conventional patching, any day, because of the reasons I mentioned earlier. Results are very encouraging across all age groups. The only hassle is the amount of time to be given with each session at the center. Patient has to come to the center. That is probably the only hassle. But when you look at the gains and the benefits in comparison to other existing modalities of treatment, this is worth it, Gopal. Thank you very much for having convinced us finally.
He's thanking me because I am the inventor of this. I am the manufacturer and the marketing person and everything.